Well, the final countdown is on, and a lot of people are getting ready to travel for the holiday, but they're doing it just as cases of COVID, flu, other viruses are spiking.
And here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Dr. T, it's always great to see you. So let me just flat out ask you, if you're getting on a plane right now, if you're in an airport, obviously, and get on a plane, are you going to put a mask on?
So Ed, I'm going to be traveling within the next couple of weeks, and I am going to wear a mask. Mostly, it's not mandated. The CDC still recommends it, especially if you're high risk, especially if you're in a place that's not well ventilated, like, the jetway. But here's the bottom line. I'm going to wear a mask mostly because I haven't traveled to a warm place with my kids for about 4 years. I'm lucky I get to do that. I don't want to get sick during my vacation and ruin it, whether it's the flu, whether it's COVID, RSV. So that's the main reason I'm wearing a mask, even though I'm pretty healthy and probably don't have to.
I'm going to ask you this, because if we're being honest, it's going to be hard to convince people to take precautions at this point. So what are you telling patients you feel might be at risk right now?
Yeah, so again, I think, Jessica, individual risk is the key. You have to assess yourself. If I'm immunocompromised, if I'm elderly, if I have multiple chronic medical conditions, it's important to know there's a lot of travel-associated respiratory infections, whether it's COVID, flu's even more common than COVID right now. So in these cases, I want people to know that masks do work. Washing your hands works. If you're really sick, please try not to travel or stay home. If you have to travel and you're sick with a respiratory virus, then you really want to wear a mask to protect others. Okay, so I think common sense things work. And remember, the vaccine is still there. And if you are vaccinated and have gotten infected previously, there's a good chance, even if you get sick, you're going to do real well. We're doing well right now. We've been through this for 3 years. We're going to get through this. We're doing well, and we're traveling. It's not a question of not traveling. We're traveling now.
Dr. T, you're talking about vaccinations. Let's talk about treatments. You've been telling us about Paxlovid from the start. New study done right here in Boston found that it can cut the risk of hospitalization for COVID by nearly half, even if you are vaccinated. So what does that data tell you about the months that are ahead of us, the winter months?
So, Eddie, the initial study with Paxlovid showed that in an unvaccinated population, you reduce your risk by almost 90% by getting Paxlovid compared to placebo. Now, this study from the Mass General and the Brigham basically looked at 45,000 patients, most of them over 50, and 90% of them had at least 3 vaccines. And what it showed is in the group that got COVID, these were non-hospitalized patients, in the group that got the Paxlovid, their risk of hospitalization or dying was about 0.5%. In the group that didn't get the Paxlovid, their risk of hospitalization or dying was 1%. Both low, but there's still an added advantage to taking Paxlovid, even if you have already been vaccinated. Paxlovid is good to reduce the risk of hospitalization, especially if you're a high-risk person.
Dr. T, great to see you. Thanks for your advice.
You too. See you soon.
Take care.
Thank you, Dr. Ellerin. And to our viewers, if you have COVID-related questions that you'd like our experts to answer, you can email them to ask@wcvb.com.